Every 40 seconds, someone in America has a stroke. That's not a number I made up. That's from the CDC. And for most survivors over 65, the thing they fear losing most isn't their speech. It isn't their memory. It's the ability to walk to their own mailbox. Here's what most people don't hear in the hospital. At 1 month after a stroke, only about 40% of patients can walk without major help. That sounds devastating. But by the 6-month mark, roughly 60% of those who couldn't walk at all, who started in a wheelchair, are back on their feet. 60%. Today, I'm going to walk you through, no pun intended, the exact phases of recovery. What the latest 2025 research says about your brain's ability to rewire itself even past age 60, and 5 specific exercises you or your loved one can start working on right now. Stay with me. This might be the most important 15 minutes you spend this week. I'm Dr. Ethan Carter. I'm a rehabilitation medicine specialist, and I've spent years helping people get back on their feet. Literally. After strokes, after surgeries, after the kind of health events that make you wonder if life will ever feel normal again. I've watched hundreds of patients over 60 go from a wheelchair to walking across a room. Some took weeks, some took months. But the common thread wasn't their age. It wasn't some magic drug. It was the plan they followed and the team around them. Now, if you're watching this from a hospital bed, or you're the son or daughter sitting in a waiting room trying to figure out what comes next for mom or dad, I want you to know something. There is a roadmap. You're not guessing in the dark. And that's exactly what I'm going to lay out for you right now. What stroke does to walking. Let me start with the basics, because understanding what happened inside your brain is the first step to fixing what's happening with your legs. A stroke damages the motor pathways in your brain, the highways that send signals from your brain down to your leg muscles, telling them when to fire, how much force to use, and how to keep you balanced. When those highways get damaged, the signals get scrambled or lost completely. That's why, after a stroke, you see things like foot drop, where the toes drag because the ankle can't lift, or hip hiking, where someone swings their whole hip to get the leg forward because the knee won't bend properly, or that wide, circular step pattern doctors call circumduction gait. These aren't random. They're your body's best attempt to move with a damaged control system. And there's another piece people miss: sensation. Many stroke survivors lose feeling in the bottom of their foot. Your brain literally can't tell where your foot is in space. Imagine trying to walk on a leg you can't feel. That's what millions of people are dealing with. Why age 60 plus matters, but doesn't mean game over. Now, let me be straight with you about age. Research shows that for every 10 years past 60, functional gains during rehab decrease by about 7%. If you're 70, recovery might plateau around the 1-month mark, while someone younger might keep improving for 6 months or more. But here's what I tell every patient. Slower progress is not no progress. The gains are real. They just take more patience, more repetition, and a smarter plan. And that's exactly what we're building here. Neuroplasticity, your brain's built-in repair system. Here's the good news, and it's backed by hard science. Your brain has a built-in repair system called neuroplasticity. It means your brain can literally rewire itself, build new pathways around the damaged area, if you give it the right signals. The most responsive window is roughly the first 60 to 90 days after stroke. That's when your brain is most hungry for new input, most ready to change. But here's the critical detail. The signal that drives neuroplasticity isn't a pill. It's movement. It's repetition. It's exercise. A 2025 study presented at the American Heart Association's International Stroke Conference found that adding just 30 minutes of progressive walking exercise to standard rehab significantly improved both mobility and quality of life at discharge. 30 minutes. That's not running a marathon. That's structured, supervised practice. And it works because it triggers something called BDNF, brain-derived neurotrophic factor. Think of BDNF as fertilizer for your brain cells. Exercise floods your brain with it. And before you think, well, that's for younger people, multiple 2025 reviews confirm that moderate-intensity aerobic exercise enhances neuroplasticity in older adults specifically. Your brain doesn't stop learning at 60. It just needs a reason to learn. And walking is that reason. Phase 1. Acute Hospital. Days 1 to 7. Phase 1 starts in the hospital, sometimes while you're still in the ICU. The priority here is medical stabilization, making sure the stroke isn't progressing, managing blood pressure, preventing complications. But even in this early phase, movement matters. Your physical therapist may have you sitting upright in bed, dangling your legs off the side, shifting your weight. It sounds basic, but these small actions are already sending signals to your brain saying, we're not done. We're going to move again. Phase 2. Inpatient Rehabilitation. Weeks 1 through 6. Phase 2 is where the real work begins. This is inpatient rehab, and the gold standard, backed by both the American Heart Association and the 2024 VA/DoD clinical guidelines, is 3 hours of therapy per day, 5 days a week. That sounds intense, and it is. But those 3 hours aren't all walking. They include physical therapy, occupational therapy, and speech therapy if needed. The walking portion starts simple, standing between parallel bars, weight shifting, taking a few supported steps. Then you progress, walker, then cane. Some facilities use a treadmill with body weight support. Imagine a harness holding part of your weight while you practice the walking motion. The 2025 Canadian Stroke Best Practices Guidelines rate both treadmill and overground walking training as reasonable approaches for gait recovery. If you have foot drop, your therapist may fit you with an ankle-foot orthosis, an AFO. It's a lightweight brace that keeps your foot from dragging. Don't resist it. An AFO isn't a sign of failure. It's a tool that lets you practice more safely and efficiently. This phase is critical because it overlaps with the neuroplasticity window. Every step you take in rehab is literally building new pathways in your brain. Don't waste this window. Phase 3. Outpatient and home-based rehab, months 2 to 6. Phase 3 is the transition home, and honestly, this is where many people stall out. The structure of inpatient rehab disappears, and suddenly you're on your own. Don't let that happen. This phase should include outpatient physical therapy 2 to 3 times per week, plus a home exercise program your therapist designs for you. The goal shifts from, can you walk, to, can you walk in the real world? That means sidewalks, curbs, uneven ground, maybe stairs. Circuit training and group exercise are strongly supported by evidence. And here's a newer concept gaining traction: dual task training. That's walking while doing a cognitive task, like counting backward or naming animals. It sounds silly, but it trains your brain to handle walking automatically again, the way it did before the stroke. Phase 4. Long-term maintenance, 6+ months. Phase 4 is the rest of your life, and I mean that in the best possible way. Recovery doesn't have an expiration date. It slows down after 6 months, yes. But research shows continued structured exercise prevents deconditioning, reduces the risk of a second stroke, and keeps you independent longer. Look into community programs, Silver Sneakers, your local YMCA, stroke support groups. Staying active isn't optional, it's medicine. All right, let's get practical. I'm going to show you 5 exercises that are safe, effective, and require zero equipment beyond a sturdy chair and a countertop. These are not replacements for working with your physical therapist. Think of them as your homework, the reps that make rehab stick. If you've recently had a stroke, get clearance from your doctor before starting any exercise. Have someone nearby when you first try these. Exercise 1. Seated marching. Sit in a sturdy chair with both feet flat on the floor. Now, lift one knee up, like you're marching in slow motion. Lower it, then lift the other. Alternate sides. Nice and controlled. 2 sets of 10 on each side. This builds your hip flexors, the muscles that lift your leg with every step you take. If you need to, hold the armrests for stability. That's fine. The goal is the motion, not the speed. Exercise 2. Sit to stand. This is the king of functional exercises. Scoot to the front edge of the chair, feet shoulder width apart. Lean forward. I tell my patients, nose over toes. And push up to standing. Use the armrests at first. As you get stronger, try it with your arms crossed over your chest. 3 sets of 5. This targets your quads, your glutes, and your trunk control, the 3 muscle groups that matter most for walking. Exercise 3. Standing weight shifts. Stand behind a sturdy counter or kitchen sink, something you can hold on to. Now shift your weight slowly to the left, then to the right. Feel the pressure change under each foot. Then try forward and backward. This is teaching your brain to trust the affected leg again. It's also training your balance reactions. 2 minutes, rest, then repeat. It sounds simple, but this is neuroplasticity in action. Exercise 4. Heel raises and toe raises. Same position, holding the counter. Rise up onto your toes, hold for a second, lower down. That's a heel raise, 10 reps. Then lift your toes off the ground, keeping your heels planted. That's a toe raise, 10 reps. Your calves handle the push-off phase of walking, and your shins handle clearance, getting your foot off the ground so it doesn't drag. For patients with foot drop, the toe raise is especially important. Go slow and controlled. Exercise 5. Supported walking with a metronome. This one is my favorite because it combines technology with brain science. Download a free metronome app on your phone. There are dozens of them. Set it to a comfortable tempo, somewhere between 60 and 80 beats per minute. Now walk down a hallway, matching your steps to the beat. Left foot on one beat, right foot on the next. This is called rhythmic auditory cueing, and there's growing evidence that it helps improve cadence, symmetry, and confidence. The rhythm gives your brain an external pacemaker when its internal one is disrupted. Not every patient responds equally to this technique. The research is still evolving, but it's safe, it's free, and I've seen it make a real difference. Before we wrap up, I need to warn you about 4 mistakes I see families make all the time. Mistake 1. Taking it easy for too long. I understand the instinct. Your loved one just had a terrifying medical event. You want to protect them. But the brain needs challenge to rewire. The 2025 AHA research confirmed that progressive intensity, gradually pushing harder, is not only safe, it's essential. Resting too much in the first 3 months is wasting the neuroplasticity window. Mistake 2. Refusing the brace or walking aid. I can't tell you how many times a patient has told me, "I don't want to use a brace. It makes me look disabled." Listen to me carefully. An AFO or a cane is not a sign of failure. It's a tool that lets you practice more, practice safely, and progress faster. Proper AFO use improves your energy efficiency and reduces your fall risk. Vanity costs people months of progress. Mistake 3. Ignoring the other health conditions. High blood pressure, diabetes, depression. These don't pause because you had a stroke. They actively undermine your rehab. Post-stroke depression is extremely common, and it directly kills motivation to exercise. If you or your loved one feels hopeless, withdrawn, or just flat, tell your doctor. Mental health is not separate from physical recovery. It is physical recovery. Mistake 4. Going solo too soon. Rehab is a team sport. Physical therapist, occupational therapist, your doctor, your family. Falls are the #1 complication during stroke recovery, and a fall can set you back weeks or months, or worse, cause a hip fracture. Supervised practice beats heroic solo attempts every single time. I want to end with a story. I had a patient a few years back, Margaret, 72 years old, retired school teacher. She had a left hemisphere stroke that took out the right side of her body. When she came to me, she couldn't stand without 2 people holding her up. The first thing she said to me wasn't, "Will I walk again?" It was, "My granddaughter graduates in 4 months. I'm going to walk into that auditorium." The first month was brutal. Seated exercises, tears of frustration, days where she wanted to quit. Her daughter would call me and say, "She's not eating, she's not talking." We adjusted. We brought in a counselor. We changed the exercise timing to mornings when her energy was highest. Month 2, she stood alone for the first time. Month 3, she took her first steps with a walker. By month 4, she was walking with a quad cane. The day of the graduation, her daughter sent me a video. Margaret walked into that auditorium. She had a limp. She used her cane. She was slow, but she walked. And when the people in her row saw her coming, they stood up, one by one, and then the whole section stood up. Recovery after stroke is not about getting back to who you were before. It's about getting back to what matters to you. Margaret's goal wasn't perfection, it was presence, and she made it. If this video helped you, or if it gave you even a little bit of hope, I need you to do something for me. Share it. Send the link to a family dealing with stroke recovery right now. One share could change someone's entire outlook. Hit that subscribe button and the bell so you don't miss the rest of this series. I'm building a complete rehabilitation library for older adults. Everything from fall prevention to exercises after hip replacement to managing chronic pain. All free, all evidence-based. And drop a comment below. Where are you in your recovery journey? Are you in week 1, month 3, 5 years out? I read every single comment, and I learn from your stories just as much as you learn from mine. One more thing. If you or someone you love just had a stroke, ask your doctor about a referral to an inpatient rehabilitation facility. That single conversation might be the most important next step you take. Your brain is not done learning. Your legs are not done working. And I'll see you in the next video.